of the things we also looked at was that before this era, when women used to get married early, our mama them and all those people, you will see many of them before by 15, 16 they don't marry, and then they get children like 8, 10. You see, those days you won't hear things like fibroid. But these days, because of education and so many things, you now see women will reach like 30, 35 before they be married. So you discover that this thing begin grow inside the womb. So now inside womb, now in fibroid they grow. So simply put, fibroid is a tumor, not be cancer. You understand? That one we will talk about them later. Not be cancer. Okay. The thing will just grow there. And before, if you not do anything, the thing keep growing. The thing will just keep growing. Wow. And then one of the things that we want to say today, people will ask you, waiting with the cause of this thing. Why waiting the cause fibroid? From the medical standpoint, as at today where we did, the whole interplay where we know about fibroid, we say because of hormones, the hormones in the female, progesterone, estrogen, these are hormones. Usually I tell my patients they are like chemicals that make a woman. Okay. There's also the chemical that makes a man a man. Okay. So you will see women, usually their voice is very soft. Usually you see them, they don't have facial hair, they don't have gemu,
and they don't get big voice.
So all of these as a result of the interplay of those hormones. So what really happens is that between the menstrual cycle there is an interplay of progesterone, estrogen, and then usually when these things go unabated, that is, you are having your menses right from when you attain what we call menarche. That menarche is the age when a woman sees her first menses. Menarche is that's the time when you see your first period as a woman.
I don't let this one
So at that age, you run through from there till maybe like 30, 40. No break. No break. Like, when a woman is pregnant, usually she does not menstruate. You get what I'm saying? So when it is left unchecked, that is, you just keep menstruating, nothing break. So before you know it, those things, they act on the tissues of the uterus and then begin develop tumor.
Wow.
Sorry to say, from epidemiologic studies or studies of just descriptive studies looking around, we discovered that one of the people that have category of people that have the highest number of fibroids, sorry to say, not to castigate them or something, they are reverend sisters. Our good sisters in the church. One of the things is that within them, because they are uterus, they've dedicated it to God, as you know. They don't carry pregnancy. So you discover there is no interruption with the interplay of these hormones. So as a result of that, they are one of the highest number of people that you see. But generally speaking, fibroid is seen more in blacks than in white.
But why? Why so?
Yes, the budding, that is part of the studies that are still going on. This could be as a result of certain cultural practices or dietary causes and all of that. But somehow we've not been able to explain why. But there is a huge burden. That means there is a huge number. In fact, there are certain studies that say that out of 10 women, 5 of them have fibroid. That's almost like 50% of the population. So if you bring in 10 women into this room now and you scan them, 5 of them will have one form of fibroid or the other.
Interesting.
And as we go along, we will still talk about it, because it's not all fibroid that is operation. Especially if the fibroid has not started disturbing you, we call it symptomatic uterine fibroid. Till when the fibroid becomes symptomatic, and then depending on the size, you understand. So it's not just the fact they say you have fibroid and then you begin to
run around for operation,
for surgery, because surgery comes with a lot of risk, a lot of complications with surgery. But it's also good for me to say at this point that as of today, when you have what we call symptomatic uterine fibroid, that's fibroid whether as a result of the size or location, it has started disturbing you. The best way to deal with it is through surgery.
Through surgery. Okay. Before we even reach that side, I happy to say you'd already explained the causes of fibroid, at least the fact say person will be say they menstruate continuously from the stage of menarche.
Yes.
But apart from that one, we still get any other cause of fibroid, because average African or Nigerian, some of them will believe say witchcraft or maybe heredity or family history. You understand?
Those are the myths. The myths, a lot of myths. You know, in fact, there are people spiritually, they've described it as the stone of witches. That in the night witches came and stoned this person and dropped some stone inside her womb. You know, so there are a lot of myths about fibroid. But from the medical standpoint, it's just the fact that, you know, the uterus is left empty, and then as these hormones, the interplay of these hormones, it's what bring about. That is what we know for today. Because you see, knowledge is progressive. As we go tomorrow, we may have other things. And then there are a lot of people have said, oh, eating red meat. People have said maybe this and all of that. But we have not been able to place our hands on anything. You know, people may say there are certain risk factors, you know, and possibly, you know, we have also discovered there are some familiar tendencies. You know, just like, you know, there are certain people, you know, something we say they inside blood. Where we say grandmother get, mother get, daughter get, you know, so it runs. I have seen a family like that where, in fact, the mother had two daughters, and had to operate them at different times, you know. So it's something that it's possible that it runs in flow. And then when we're talking about, it means that certain chromosomal, some chromosomes that sort of like help these tumors to grow. So it's what we say in local parlance that, oh, this thing they inside blood, you know. So we have discovered that there are certain, there is a familiar tendency with fibroid.
Okay, before we even progress to know the symptoms and all, I beg, then we prevent them, or the only way to prevent them is to make sure, say, when time reach, when you mature, you know, to get belly, shall get the belly.
You know, the truth is that prevention. Well, there is nothing we can really say than the fact that, just like certain things we discover, being a reverend sister or being a woman in advanced age without a child, we give you that, you know. And if you've been around for a while, you know that fibroids are not as common as they used to be now. You know, and that was because of the lifestyle, the marriage pattern of females. You know, so somehow, from my own little practice as a gynecologist, I've begun to encourage a lot of young girls get married when it's time. You know, and it's good for me to say this, that the best time for a woman to be married between the age of 20 and 30. Those are the best times to be married and have your children. Anything after age 30, you might be running a long course. You might be hitting something somewhere. You know, so it's always good that we encourage a lot of young people, because you see women come in their 40s, their late 30s, and they're telling the doctor, I wish I knew, you know. You know, and the thing about fibroid is that to a very large extent it could be very disastrous. You know, the impact on your womb, you know, even after surgery, the risk of what we call adhesion formations and all of that. You know, so it's good that we encourage young girls, you know, to be open to marriage, especially if that is something you think you want to do in your lifetime. You know, be open to marriage, be open to having children when you should have them. You know, but having said that, a lot of people say, so if I don't get husband, you know. So generally, these are just things. Anything we can say now is more speculative, because we can't say, oh, don't do this, do that, you know. But generally, this is
just be open. Be open to marriage if he comes, and if you don't come, pray. May God just bring your own man. Now, maybe we talk about the symptoms. Waiting for they do me now, I go no say okay, or it be like say I don't get fibroid, because you know, as Nigerians be now, self-medication are one of our biggest problems as a country, as a nation. Any small way they do you see that na ulcer, if na belly, if na ulcer, if na body, na fever. You understand? So any small thing they don't go.
So one of the key things we should talk about, the symptoms, signs of fibroid. One of the key one is heavy menstrual bleeding.
Heavy menstrual bleeding. Oh, wow.
Once you discover that before you used to bleed maybe for 3 days, but now you're bleeding for 9 days, 10 days. I've even seen women, they bleed every day for a whole month.
Wow.
You know, so once you have heavy, prolonged menstrual bleeding, one of the key things that need to be ruled out is uterine fibroid. It needs to be ruled out. It's not the only cause of heavy or prolonged bleeding, but it's one of the key things that must be ruled out. And how do you do that? You go for an ultrasound, because ultrasound is one of the best way to pick uterine fibroid. You know, so when you have heavy, prolonged menstrual bleeding, it's a reason for you to check. It could be possibly be fibroid. Then the other thing, when you have abdominal swelling, swelling when a woman, especially the lower abdomen, because it's a pelvic tumor, it grows out of the pelvic. So for no reason, you just discover abdomen is distending. You know, I've seen women, they even say, no, I carry belly.
Okay, meaning say they show for outside.
Yes, it's coming out. Some women, you see them as if they are 9 months pregnant. It's usually fibroid. It can be as big as that.
Wow.
You know, I've seen some that are even as big as you carrying a twin, a 45 cm uterine mass. Jesus. You know, so once you discover for no reason you are having abdominal distension, as a woman, your belly they grow,
your belly they
come
grow.
out, you know, and then sometimes if you touch her with your hand, it will be like saying a stone then put there. You know, it's a reason for you to suspect and go for scan and see a doctor to know what is there. You know, and then in the very advanced stages, you know, it could also cause difficulty in breathing, because if you are carrying maybe a baby, difficulty in breathing, you know, difficulty in walking, back pain, weight, yes, to carry a 9-month-old baby, you know what it means. You know, so when you carry those 2 months, you begin to have back pain, waist pain, and all of that, and you see something coming out, shooting out, and you know you are not pregnant, is a reason for you to suspect uterine fibroid. You know, and then in very complex cases, because of the heavy bleeding, you begin to have symptoms of anemia. You know, you walk small, you get tired. You discover that a little thing you do, you are panting as if you have just finished a 10 kilometer.
10 kilometers.
You know, your eyes, your conjunctiva is looking pale, showing that your hands very white. You know that because of the blood you are losing from the uterine fibroid, especially, you know, we'll talk about that shortly, about location of fibroid. Okay. Because where fibroid is located, we also give us the kind of symptoms we will see with them.
Fibroid, it gets different locations.
Yes.
Oh, really?
Yes, because the womb, it's actually divided into three components. So we have what we call the endometrium. The endometrium is the inner lining of the womb or the uterus. And that is the place gone where picking they stay. Now there picking they form, they stay, they grow. The endometrium. Then just next to it you have the myometrium. That one is the body of the uterus now surrounding the endo. You get what I'm saying? Then surrounding the myometrium you have the perimetrium. You understand? That's the tiny layer that covers the myometrium. So there are 3 layers.
Just like the earth across the mantle and the core.
You know. So when the uterus is growing in the endo, the endometrium, it usually produces heavy menstrual flow because it's staying just at the layer that is usually shed off during menstruation. So you have heavy bleeding if it is it is inside the endo, the inside.
Wow. Okay.
So, but if it's on the myometrium, it might be neither here nor there. It won't give you too much of bleeding. It might give you too much of bleeding. You know, usually those ones used to go very big, and then the one on the perimetrium, or what we call the serosa, that's the outer covering. You know, those ones usually you will not have heavy bleeding.
Wow.
Because they are not on the inside. So those ones can go very big, and the woman will tell you, oh, my menses is normal. You know, and then sometimes even those ones that are outside, those ones, the women can even get pregnant, have their babies, there will be no miscarriage.
Okay.
Because that one is right inside, outside. So it doesn't really have any problem. It doesn't cause any problem to the baby, you know.
Wow.
So depending on the location, it will also tell us the kind of symptoms
you
that
see.
you have.
Aye. God, I beg you. Well, I dey learn a lot, and I know say you where they watch us or you where they listen to us, you they also learn a lot. Just like I've been telling you, just in case you get questions, don't forget, just they jot down these points when they make, so that it will help you when you want to ask your questions. And you also, if you watch us live, either on Facebook or YouTube, we are live, and you learn a lot today. Now, when we go to the next question now, the diagnosis part and the impact on life. Normally, you talked about scanning, but apart from scanning, is there any other way where they take diagnose whether person gets fibroid?
So usually in diagnosis, medically, we talked about history, what the patient tells you. So when you go to see your doctor and you tell him your symptoms or things you are seeing in your body, that can be a pointer to the diagnosis. Then he will also want to examine you. So a woman with uterine fibroid, when you examine the woman, you discover that you are feeling something that is, you know, firm to hard in consistency. When you touch her abdomen, you discover that this tumor is usually firm, just like the nose. You touch your nose, you see very firm, and then your frontal bone or your head, you discover that one is hard. So that is the consistency of what you feel when you scan or when you examine the patient. Then other imaging modalities, we talked about the ultrasound scan. You know, it's one of the commonest ways that we can diagnose or look at a uterine fibroid. Then other modalities include things like CT scan, you know, MRI, especially if you want to delineate the location of those fibroids, whether they are right inside, you want to do an MRI and pick them up where they are really located. You know, so those are the modalities that we can use to diagnose uterine fibroid.
Interesting. Then again, because this question is very important. We don't hear of so many persons where we say maybe where they no born for some time. The first question where people they ask, you say, "You get fibroid?" You understand? Although that one are for common men like us, but medically now, fibroid it affect fertility and the ability to get belay.
Yes, with uterine fibroid, though from studies will not be, it will not be said conclusively that because this woman get fibroid, she no go get belly. And one thing we discover is that it is possible for a woman to have fibroid and still carry belly. You understand?
Oh, I don't see case like that. When she go born fibroid, come born pikin.
No, maybe she not go born. The pikin will come out first before the fibroid.
Oh, meaning they feel still born fibroid like pikin.
No.
Okay.
You know that one. Now one thing where I want correct. Because you see a lot of people who they spend money, buy all kinds of agbo, buy all kinds of supplements. These one, they say no, if you take calm, I tell you, after how many days you go shit this fibroid, you go come out now. We know the anatomy of this thing. The way those fibroids are, it's almost impossible for you to say, take this thing and then the person will deliver
the fibroid.
No. Except that means you go deliver your womb completely. Your womb will come out. Because nobody say those things they are hanging somewhere. No. From what I've told you about the endometrium, the myometrium, if it is inside myometrium, that means the whole of your womb will just because I have seen women who taking all kinds of things, all kinds of herbs. There's even a woman, she took so many things that her liver collapsed.
Oh my God.
Because the liver is just like a mass inside an organ. And some of those things do not know whether this one are fibroid or this one. They attack her liver. I told you this woman died.
Jesus.
No, from liver complication. She had all kinds of. She
wanted to treat fibroid and she took that liver.
So they tell you take this one. If it is for fibroid, I can almost 100% tell you all those things they tell you take. It will come out now. The only thing I will say today is that yes, some of those things they can shrink the fibroid.
Okay,
they can shrink it. Even medically in orthodox medicine, there are a lot of things. When we come to the options of management, I'll talk about that.
Okay.
There are drugs we will give you. Those fibroids you are carrying right now will shrink. But what are the side effects of those medications? Let's say for a woman, 25, 30, give you those things and you are now looking like a 50-year-old woman. It will shrink those fibroids for you. So it's not new when they tell you go and take this thing, the fibroid will become small. But what are the side effects of those things? You see, a lot of the herbs we take, they are the things we use for producing money or these drugs that we're using in the hospital. So it's not as if it's something new. They will tell you, charge you a lot of money, pay 500,000. Let's get this. No, I don't see and it will work. But what of the effect on your whole system, your liver, your kidney, all of those things, you keep taking them without knowing what you are taking. At the end of the day, you're going after a fibroid and then you end up with your kidney, you have to go on the dialysis, you're looking for kidney transplant as a result of just fibroid. As I said, it's not all fibroid that should be touched. It's not all fibroid we should go over them. But once they become symptomatic, it is advisable you see a qualified gynecologist to see you and then based on certain criteria be able to make decision. In most cases, surgery is one of the best options for management of uterine fibroid. Even though today there are a lot of very advanced technologies that we have, what we call the high intensity focused ultrasound, where there are machines. I think we have a center like that in Abuja now, where you can go with those machines. They'll just put them on you, just like ultrasound scan. It can help to shrink the fibroid. It can help to, instead of surgery, you can do that. But as of today, as we speak, it's still on the very high side. But it's an option of management, But all of these things, you need to see a gynecologist to be able to tell you what would be best option for you. But as of today, in this part of the world, open surgery is still one of the first things that we will do, But then there is something we call endoscopic surgeries, keyhole surgeries, where you use either a hysteroscope, a laparoscope. You can go in, just through a small hole, and then you can pick up those things out from inside.
Interesting.
But as we said, the cost is still one of the things that is hindering most of those things. But sometimes, because of the location, open surgery will be one of the best things that will still give you a good outcome.
Interesting. Okay.
So now, still yet, I said it's not all fibroid we go after.
Okay.
It's very important. Because I saw a woman recently who came from somewhere, I think around the Abaji or something, and he was telling me that this doctor was insisting he must be operated. A fibroid of about 2 by 3 cm that is located, as I told you earlier, or just on the body of the individual. She doesn't have any symptoms, nothing, just because scan said. And I told her, no, it doesn't do anything like that. Because even the surgery, as I said, it comes with risk. Life generally is a risk.
It's a risk, yes.
You understand? The fact that maybe somebody drove a plane and the plane crashed does not mean that tomorrow we will not drive plane. No, somebody drove a car and died. It doesn't mean we will not buy cars. So with anything we do, there are levels of risk.
But for that one, when you don't qualify for operation, that means the risk will be very, very high with that. For those ones that will never reach operation, where they're not
like those ones, because those ones you are not supposed to touch them. You understand? Because they have not done anything to the patient. They have not done anything, But generally, we say that if a woman is married, seeking for conception, and then you've been there for maybe 4 or 5 years, and then you have some fibroids, even though they may not be symptomatic, they may not. Sometimes you just say, okay, let's just go and take it out. Not because they are the cause of your problem, but then because they are inside the place where we are expecting something to happen. I may just decide, okay, let's just leave them out. But especially if they are located inside or in the body of the uterus, then you can make that decision. So usually with treatment of fibroid, there is need for what we call individualizing treatment. So you see your people one after the treatment for Mr. A or Mrs. A may not be the same for Mrs. B. Depending on risk assessment, what we have seen, So it's not all fibroids that are for operation. But when you see a qualified gynecologist, they will be able to bring all of these things on the table and know what should be done at every particular time. So the fact that you have fibroid does not mean you can't get pregnant. But sometimes we now say, oh, you've done everything. Still yet. Okay, let's take it out.
Make it for the seed, maybe.
And then sometimes fibroids and miscarriages. Fibroid and miscarriages. Yes, especially depending on the location. Those ones that are located in the endo. Endo means the inside. Because that is where the baby stays and begin to take root. Like plant when it's growing, it takes root into a hair. So when they want to take root and then the fibroid is there, because the blood supply to the fibroid may not be as, when ground no dey fertile enough for seed. So because of that, it could be a cause of recurrent miscarriage. Depending on the location. Depending on the location. For those ones that are on the body like this, cirrhosis, as I said, those ones outside. Those ones may not really, in fact, yesterday or the day before, I had a patient like that. Went into theater, she had a baby. Yes, it was a cesarean section. The thing was just hanging on the body of the uterus, and we just took it out. She's fine. So it's possible. The location is very important. In a lot, both in the symptoms, what we see, both in the treatment, the location is key.
Okay, now what we don't talk about location now. I bet more talk about the treatment options and the myths where we get for Nigeria as Africans. If person get fibroid, you don't already talk saying no be all fibroid and they do surgery for. But what can be the different treatment options where we say if they are available at the moment? And again, depending on the type of fibroid, just as we take talk about.
Yes. So generally there are you can break them into about 3 broad categories. You could have what we call surgery. Hair surgery, which could be open surgery. That's one of the commonest options of treatment here. Then we also have the medical management. Medically, there are drugs that can be used to manage those fibroids. If, for instance, the fibroid is giving you heavy menstrual, there are drugs that can be used to manage it. Once you see a gynecologist, they'll be able to do that for you and manage it in such a way that you can still have very good quality of life. Then the other one is the most recent things that we're talking about, things like the high intensity focused ultrasound, where you use an ultrasound. There are energies that are projected at it, and then helping to shrink the fibroid, and then we also talked about the minimally invasive approaches where you use surgical methods, the keyhole surgeries like hysteroscopy, laparoscopy, where they go in, they may not really cut you, maybe just a tiny hole the size of my finger, and then they can be able to pick those things out. and
Okay.
all of that. So those are the options of management of uterine fibroid.
Okay.
Yes, there are things we call embolization, uterine
Okay.
fibroid embolization, and all of that. That is a means where through those keyhole procedures you can introduce certain agents that will help to block the blood supply to the
To the
fibroid.
fibroid.
You understand? And then in that process, the fibroid generally will lose all its blood supply, and then the symptoms will wane down as you do that.
The fibroid is like a person living inside of the woman.
Yeah.
Oh my God. Okay, now we are in Nigeria, and just like you said, them sabi give agbo to so many people when they say they get fibroid. But maybe we even talk about some of the natural remedies. We get anything like natural remedy or maybe special food where people feel chop to shrink the fibroid. Hence, they no fit burn am as they make us believe those days. Because even me, those days I believe say they fit burn am. You understand? But we get any natural remedy like natural treatment, natural food where they fit eat to manage fibroid or to even shrink them?
Well, yes, that will still be at the level of research.
Okay.
And then some isolated things here and there that people will be talking about, but it's not yet documented.
Okay,
That
for
these
now.
are things, for sure, this is what you can take, and then all of that can help you deal with fibroid. So, but generally we discover that with obesity, people who are very fat,
Okay.
they
Okay.
also have a huge body of fibroid with them. So in essence, you discover that dietary counseling, where you cut down your calories, the intake of food and all of that, see, there are people who are heavy eaters, and what that translates to is obesity. A lot of fats. So as much as possible, it is good that you cut down on intake of calories and all of that. That it has a way of helping to also prevent. Because with fat people, you will have almost double the number as compared to people who are slim. Your BMI is a very big thing in the medical field. When you talk about BMI, your body mass index.
Okay.
Generally with higher body mass index, there are a lot of diseases that are associated with that.
Yes.
Things like hypertension, diabetes. Once your BMI is above the normal, anything getting to 20 something to 30 and above, the risk of so many conditions coming up. You could become diabetic, become hypertensive just because of size. So it is very advisable that people cut down on intake of calories. And then, all of that, as I said, is in the realm of research. We can only speculate, but we cannot really definitively say, because you are taking red meat, you are taking this, you are taking that. But generally, we advise that people watch their weight.
What they eat.
Females, watch your weight. Try to exercise. These are general advice. Weight loss, exercise, and then your diet.
Okay, now talking about exercise, another exercise where some people been talk say, just like I've been talk that, and one of the myths where people believe say, if they do this thing, if it also, reduce fibroid, or if it burst them, or if it spoil the fibroid, so they get into what they call sexual intercourse regularly. How they take, if it prevent fibroid, as man and woman they knack, so if it prevent fibroid.
No.
Okay.
Just like I said, most of these things are still speculative. There are no definitive scientific basis for saying those things. In fact, I've not even heard that frequent intercourse has a way of. But generally, exercises. Exercising and an athletic person, females, you hardly find them come down with those things actually, because some of the free radicals and things that are being generated in the system, they are being mopped up as a result of exercise, as a result of what we are eating. You know, we say eat more of things that come from plants than things that are manufactured inside plant.
Oh, interesting.
You know, plant where maybe Coca-Cola plant.
Yes,
So it is good you take more of things that come from natural plant inside farm than those ones that come from plant where
the machines
where they are producing.
Interesting. Word. That is powerful. Now, before we you feel call us, so if you call us, ask your questions. If you call 090 73 53 0044 090 73 53 0044. You also feel call 090 97 05 4450. Any of the lines where if you call. Okay, I don't lost your call. If you call back, if you feed 090 97 05 4450. You also feel drop your comments and I will read them out as well. Hello. Hello? Okay, I lost your call. You feel call back if you fit. Hello?
Honorable Teddy Green.
Yes,
Good
sir.
evening, sir. How you doing today?
I do, thank God. How you doing?
Well done for your lecture. God bless you, yeah?
Thank you very much.
I greet our guests. I want to, because you dey ask a question, is there any harm where you go fit stop fibroid? Because I already listen from all this fibroid, how it take come. They say, some people say food where we dey eat. How food where we dey eat, it go cause fibroid. The food where we dey eat, it go cause fibroid. When me are there for my village, I always dey refer to my village. We don't know what it be fibroid. Guys, they this thing where they call fibroid, so now blood, the thing is strong, that be fibroid we know. And if you open and you go see say na blood, the thing be. When me are there for home, if person say stomach is the pain, one side is swell up. Wetin we go do early in the morning? You carry her, you go buy new laser, you go tell her.
Wow.
You go see that blood, black blood, you go come out. Now we dey use our language, they call her oh my, now oh my they call her.
Oh my.
Then they go tell her you go use charcoal with this palkanya oil, mix her together, take a rubber. The thing don't go gabadia, but all these people come. The medicine where they put for us, the food where they put for us is giving us sickness. But we are not giving this fibroid. We will not know what it be fibroid. Make them tell us. Is it blood? Like now, if they say people get blood, we go say, okay, woman wey no dey born again. Where it just stop, where the blood no go rush, come up for a body, now that blood go gather. Now it go cause that thing pain. But you know, they want to turn at one of that thing, say fibroid. I want make them explain for us what they call fibroid. I will pick on you again, I beg.
Okay, Doc. I think it's a part of the meat.
It's all right. Yes, you know, like one thing we don't even discover, we say, if woman get fibroid, as she advances in age and gets into what we call menopause, the fibroid go on its own will begin shrink.
Are you serious?
You understand?
It will just begin shrink. Wow.
So even if the fibroid they bleed before, they cause heavy bleeding. You know, as you enter menopause.
Hello. Yes, your radio is very loud. I mean, no, I'm already
Sorry, thank you very much. Let me read. I put it on right now.
So what will be your name?
My name is Dan.
Dan. Okay.
Yeah, I was listening to the man in the house, the doctor in the house,
okay.
And I heard that this fibroid substance, when a woman is losing so much blood during her period, it can be as a result of having fibroid.
Okay.
But I want to know that is it possible for the woman who has children and above 50 to still experience fibroid? That is one. And two, I also want to know if it's possible for a woman at 50 or above 50 or this sorry, what is the exact age of a woman to go into menopause?
Okay.
Thank you.
All right, thank you, Dan. Yes, I think, okay. Maybe we'll finish with you in the try talk doc before we respond to Dan.
Okay, yes. So
she been talking about swelling where people just tear, the bad blood will just come out.
As I said, fibroid is a solid tumor.
Okay.
It's a solid growth, you know. And when you bring it out, if you go to the internet, just type fibroid, you see the pictures. They are clear tumors, not blood.
Not
where they
blood
go,
where clots
no.
to one side.
And then this one is a woman we born, the blood gather. No, what I was saying, with advancing age, fibroid is actually a tumor of, it's something that happens within the reproductive ages.
Okay.
Once a woman enters menopause, I think that is where the next question.
Yes, the next question.
Once a woman enters 50, you see, menopausal age is a range.
Okay.
Usually in this part of the world, from 45 to 55.
So no definite age.
Yes.
Okay.
That's individualizing things that I was
That you
trying to
talked
say.
about,
You know?
yes.
So just like our faces are different, you know. So, but from 45 to 55 is a range. You know, but the average around this part of the world is something around 50, 51.
Okay.
You get what I'm saying? So usually at 50, a woman bleeding, it's the first thing that comes to mind medically is cancer.
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 Please,
Once
let's
you
just
see a
hold it
woman
there.
above 50 bleeding,
Hello, good evening, Honorable Affairs.
Okay, sir, let's take this one. Hello, good evening.
Hello, good evening, sir.
Yes, good evening.
Yeah, this is Honorable Mayor.
Honorable Mayor, nice to have you. Welcome, sir.
God bless you, sir. I want to ask our doctor in the house, can maybe somebody that maybe are doing abortion before, that maybe can cause those things you're talking about? Let us know. Thank you.
Okay, that is okay. Okay, that's a very good question. The previous abortions, but you were talking about bleeding for people who don't advance for age.
you know, so usually once you see a woman 50 and above bleeding from the vagina, the first thing that comes to mind is cancer.
Okay.
It could be cancer of the cervix, it could be cancer of the endometrium, it could be cancer of the womb. Cancer, the first thing that comes to mind is cancer.
Okay.
You know, because even if you had fibroid before, as you get towards menopause, all the symptoms of fibroid dies.
On its own?
Yes.
Wow.
Begins to go off. You know why?
Wow.
It gets back to what I was trying to tell us from the beginning, that scientifically the reason for fibroid is the interplay of hormones.
In an empty womb.
Yes, and you see that the woman's hormone, and then they make their face fresh, fine. You see woman body smooth, estrogen. You know, so those hormones, as you advance, you discover the woman don't begin the war.
Yeah,
you
not
understand?
true, not true.
So waiting happen, we say estrogen they go down, all those hormones they go down. So at that age, fibroid, no, they, you know,
No get
because
level
now
again.
where we say now those things cause harm. So now that time when woman now fibroid they talk. But once immediately you are going, your hormones are going down. That is what is menopause. Menopause is just a change in the hormonal level of the female. Estrogen, project, all those hormones just begin. So the woman begin what you see your mama for before we file like
wrinkle and all
this, you know.
Wow.
So at that time the action in the womb to also dwindles. So even if fibroid dey, waiting they supply and they make fibroid grow, estrogen, progesterone, all those hormones they go down. So fibroid will they lose form that time. So sometimes we even tell some women maybe 2-3 years, you see they say you don't almost reach menopause, no will not cut you again, just leave the fibroid there. Once you enter the place where this thing go down, natural healing don't happen with that.
Wow.
You get what I'm saying? But except if it's so big and it disfigures the woman, we just say no problem, so make we just remove them. You understand? And then the fibroid we have in West Africa generally. In fact, you know, last year I was in South Africa for a conference, international conference of gynecologists from all over the world. I remember somebody say, let's call our colleagues from West Africa, let them come out. Because the two more fibroid we will get from West Africa.
It has based on our economic situation.
You know, so they think they heavy, you know, for West Africa. In Nigeria, you see person fibroid wey fit full bucket. You know, those things, you go to America, you don't find them. So sometimes even women come from the diaspora, all part of it, to come and get operation here.
Wow.
Some of them come, I've seen a lot of them coming from Germany, all those places, to come and operate fibroid here. Because we still dey see am now, we still get the skills to take care of those things.
No, they see the Oga Kwata of them fibroid.
You know, so but at a very more deeper level, there are research going on to try to really see if there are certain food, certain lifestyles and things that fuel the growth of these things.
Okay, now the question where Mayor ask, abortion. People will be saying maybe they don't do abortion before. Is there any link? Then get any link with because you don't do abortion before, you feel get fibroids?
No,
nothing.
There is no link with the fact that maybe abortion is a precursor for fibroid. No, nothing like that. Nothing like that. Abortion has its own complication because one of the things from abortion, there could be introduction of infection that will ascend into the fallopian tube, block your tube, tuber block, and all kinds of things that could lead to infertility later. But say fibroid, no, there's no.
Okay, you don't hear about capital no, Mayor. Then this one now, you know, I don't see some women say them don't operate me before, it can't come back. Like even for the events, that last event where we've been get for Mercy Hospital, one that they also do free operation for people. Make I take this call. Hello.
Hello, good evening, sir.
Yes, good evening this evening.
Thank you. My name is Kingsley. I'm calling from Duce.
Okay, Kingsley, welcome.
Yeah, thank you. Please, there is this question I want to ask. The question might be funny, but I'm a bit confused about it.
Okay.
This fibroid we're talking about, can a man have the fibroid? It can be funny. Because there is a case of a man I knew. At a point, his stomach started swelling up, and that time he was advised to be taking blood tonic every day. He takes blood tonic every day. At a point, they said he had to go for operation. They operated him. What they brought from his stomach, they put inside the bucket. It was his son that took that into. They say he should go and bury it. It looks like a kind of something. It was very big. They put it inside the bucket, inside this 20 bucket, this 20 liters inside this 20 bucket. He took it to the village. He took it to go and bury it. So even within the house, it doesn't have it has some opening around it. They say the fear is soft blood and all that. From the way this we are describing, you people are describing, or doctors do describe this fibroid or something like that, it looks like that particular thing that guy brought that particular day from the hospital. They say he should go and bury it. So I'm so confused about it. Please, can you address this question a bit?
All right, thank you very much, Kingsley.
I don't think man no get womb, man no get uterus. You understand? So fibroid is a tumor of the womb or the uterus. So it's possible tumors go everywhere. You understand? You can have tumor in the liver, you can have tumor in the kidney, you can have tumor even in the intestines. You understand? They could something just start growing.
Wow.
You know, so it could come out like that. You know, in fact, I remember those days when I used to do general surgery. There's somebody who had a tumor of the kidney. So big, you would think that the man is pregnant, almost 8 or 7 months pregnant. But it's a tumor from the kidney.
Wow.
You understand? So any of these organs can just develop something. But categorically, from tonight, we said a man cannot have fibroid.
And thank God
because he don't get womb.
If fibroid go join wahala of men, it'll be wahala
with wetin dem dey suffer now.
Man no need fibroid. But doc, our time is fast approaching. But then before then, fibroid. Okay, just like I've been asked, if he come back after operation, because that event what we do last time, one woman be meet me say she don't do am before. Because if you remember, you've been talk say for that event talk say if you don't do fibroid before, you need to open up to the doctor where one operates to check if you still dey okay. Why fibroid? Something they don't do. Why they come back?
Yes, usually, you know, just like we said, you know, there are some familiar tendencies. I've seen somebody as young as 23 with huge fibroid.
Oh my God.
And you just wonder, what happened? Anything happened? You know? Usually the peak age of incidence of fibroid is between 30 and 40.
Okay.
You understand? That's where the peak incidence, when we say incidence, that's where it happens most.
Okay.
Those ages between 30 and 40, followed by between 20 and 30. So 30 and 40 comes first before those between 20 and 30 usually we see less of it. You get what I'm saying?
Yes.
But just like we said, this tumor or this fibroid is something that exists within the reproductive age, and the reproductive age is between 15 years to 40. Well, maybe 45.
Depending on your nature.
You understand?
Okay. Then what about the recovery period for typical fibroid operation?
Yes. And then, as I said, fibroid can go again.
Okay.
So like somebody now, you had fibroid when you were 25. You didn't get married after the surgery, you didn't have any baby. And then again at 35 again, the thing goes, because the hormones, as I said, that is the genesis. Don't forget that hormonal thing, because that's the theory scientifically around the growth of fibroid. Say because of the interplay of those hormones, their woman hormone and all that is what comes. You know, but then there are familiar tendencies. There are people who are more predisposed than others to it. I told you about a family where the mother, the grandmother, children, all females, they just have. But there are families where you don't even hear of such things.
So they feel link them to gene or never.
Yes, there are studies that have actually, there are some genetic evidence. There are things that have been mapping that have been done.
Okay.
You understand? And that is where the theory of the familiar tendency about fibroids come from.
Interesting.
You know, so it can grow again. It can grow again, and that's why sometimes when we are operating people, jokingly we ask them, "I hope say the man is waiting," you know. And then somehow when we have women who are young, the fibroids are not really. Just wait till when you get pregnant. You know, when you get married.
Okay.
So if you get married and maybe you stay for a year or two, something is not happening, then you may need to say, okay, let's look at this fibroid more closely. You know, because doing those surgeries, there are a lot of things with surgeries, you know, but when it is done by professionals, when it's done by specialists, it's different. It's not just any place you see, hospital, you just enter, lie down, maybe they open you up. A lot of things with fibroid. You know, because from fibroid surgeries, if you're not careful, your fallopian tubes could be blocked.
Oh wow.
You know, and then certain fibroids are so bad that it is also good that as you're going in, you also know that you may come out from that surgery without your womb.
Wow.
You know, so scientifically, even when you come to hospital, we make you to sign what we call double consent. So as you are signing that do my fibroid operation, or you are also signing that in case this fibroid they too big or the extent they too much, remove my womb if it will cost me my life.
Wow.
So you must sign those things. It's a requirement, you know. So it is not something you just go anywhere and get it done. Make sure you go to the experts. Make sure you know who is behind your fibroid surgery. It's not just, oh, okay, it's cheap here, just go. But the program we're running at Mercy Hospital, you know, it's a great intervention from the non-governmental organization called Push Africa. Push Africa is a non-governmental organization that is committed to alleviating poverty and reducing the burden of unemployment in Africa. You know, and then this great intervention, it's massive, because in the last few, it's almost 2 weeks since we started that project. You know, we've had over 100.
Can you imagine? I bet we need to.
Over 100 women have come forward to get evaluated and operated, and so far the numbers we've done have been highly successful. You know, and then there are some who actually came. I know a woman who came, he said, "No, doctor, I don't even want to make you remove this fibroid. Please just remove my womb for me."
Oh, okay, and maybe she don't.
You know, yeah, because she had fibroid before, and then she was able to have her children, and the thing is still growing. You know, she's 38 or so. She said, "No, I just want my womb." And we did it very fine. You know, so sometimes, you know, the fact that your womb is out does not mean you cannot enjoy sex and all of that. You know, we do what we call a subtotal hysterectomy for you, where your uterus, your cervix is still left. You can enjoy sex and all of that, and you can still function as a woman because your ovaries are not taken out; they are left. So you still have, because those hormones, one of the key places where they come from is the ovaries.
Okay.
You understand? So because you can still be a woman even though part of your womb has been taken out. You know, so the thing,
no place to relax.
So as much as possible, if you have fibroid, make sure you are evaluated by an expert. You know, there are a lot of hospitals here in Abuja. We have a lot of great gynecologists here in Abuja. Get to see them. You know, not just entering any place, general place, and then at the end of the day, the complication, no be small thing. No.
The money where you don't want to spend, you can't look for more money to spend. Okay, maybe that's not the more reason why you will try to visit Mercy Hospital. I think Mercy Healthcare Hospital there for Gariki for
number 46.
Number 46, KB Street.
Benin Kebbi.
Benin KB Street for Gariki. Just go there at least before this month finish. Or if this month finish, so you know go enjoy the intervention again. So at least for those of us, so now say okay, now need to do the operation, but no money. I bet just go, make you follow them talk. At least maybe with the little where you and your gaffy raise, them go feel help now. If not, fibroid operation, no be beans. So
No be beans.
Dr. Abi go like tell them how much then they really do them for hospitals. You know, within between which doctor been tell me say between 500, 1 million. I just fold hands.
If you're going to get a good surgery, you'll be talking of something about 1.5, 2 million.
1.5. If not be say Naija don't get as it be those days. Now EOD be that too. At that 1.5 will give you clean EOD before. Okay, now doc, for person who do the operation, how long if he recover from this?
Yes,
surgeries?
recovery because of a lot of things now. You know, great anesthesia and all of that. You know, in fact, when we are operating you, we're even chatting with you.
Imagine.
You know, so you are not sleeping. You know, we're talking with you, chatting while the surgery is going on.
Wow.
You know, so once you come out, within the next 8 hours,
You are fine.
you know, you're fine.
Wow.
You know, and then you can, within 24 hours, you can take whatever you want to take. You know, and then give or take in 72 hours, you're back on your feet. You can even go home. So it's as fast as that. You
Wow.
know. But then give or take within 2 to 6 weeks, full recovery.
You are
and
fully
return
recovered.
back to your,
Okay.
yeah.
Now this person has question. Say good evening, Ape. Can a woman remove her womb without operation to prevent fibroid? No, really get that point.
Yeah, can you remove your womb
womb.
without operation? Yes, that would be the minimally invasive surgeries.
But, okay,
You know,
minimal invasive.
That's we go into a very small. You understand? One small hole.
Oh, okay.
And then we can actually take out your womb from your vagina.
That means the womb no big. Oh.
Yeah, the womb is actually small. Let me tell you something. Do you know that the weight of the womb is about 50 grams? But when a woman is 9 months pregnant, the womb weighs about 1,000 grams.
God is wonderful. Hey.
So you can see how it doubles. You understand? So the normal sized uterus for a female is just about 50 grams.
Very small.
Yes. So but when a woman is pregnant, the size increases to almost about 1,000 grams.
God.
So you can see it's almost like how many times? More than 20 times.
More than 20 times of the
Double.
actual size.
You understand?
Wow.
So the womb can actually be removed without
Operation.
open surgery. Yes. You can
Wow.
remove it to the vagina, or it can be removed through laparoscopy. But those keyhole surgeries, those minimally invasive, there are few key places here in Abuja where they can be done. You understand? And then we can do what we call a vaginal hysterectomy.
Vaginal hysterectomy.
But I don't think a lot of, in our society, having children, it's a big thing.
Yeah, indeed.
Unlike in the Western world where without a child, people get married not because they want to have children.
Yes.
But here, the first sign of marriage.
Some go even say, try give am belle before na marry.
Yes,
Interesting. Okay. So Doc, wetin be your final word? Your advice, your final word to every man, every woman where they listen to us and wetin them need to. Okay, before then, abeg, just quick 3 facts about fibroid. Just quick 3 facts about fibroid.
Yes, 3 quick facts about fibroid. 1, fibroid cannot be passed out through the vagina. Say you shit fibroid, you take one supplement, the thing just come out. No.
They know they born fibroid.
You understand? So anybody telling you, say, see this thing, even though there is some form of fibroid, we call them polyp.
Okay.
It's something that looks like fibroid. Those ones, if you just hang for a woman private part, so you put your hand, you will see them. You call it a polyp. You understand? Even with that one, we must do small this thing, cut and come out. You get what I'm saying? So all this lie we people be told, take this thing, you will shit fibroid. But the one where I talk, they say yes, many things they where you feel take, we go shrink the fibroid.
Okay.
But they could also have side effects. You see a young girl of 20-something, 30, is looking like a 50-year-old mama because of all of those supplements. Because they are some of those things go to block those hormones. As I told you, those hormones now they
are responsible for making you beautiful.
Yes, your face smooth, the way you talk like a woman, your hands are, you go block all those things for you. You go shrink the fibroid, but it will cause something else. So as much as possible, always see an expert. It's just like now, you can't just go and call a medicine to come and fly a pilot.
No, it's not possible.
You understand?
No.
So get to see an expert. There are a lot of experts in Abuja. Gynecologist is trained and well equipped to be able to handle your fibroid cases. Yes.
Okay. Second fact.
Second fact about fibroid, yes. In this part of the world, to still be very fair to all the latest technologies that we have, high intensity focus ultrasound scan, still yet in our own armaments as gynecologists, surgery, open surgery is still one of the best ways to manage fibroid in our environment.
Okay.
With very good outcome. Very good outcome.
All right, our third fact.
The third fact about fibroid is that fibroid actually shrinks. The symptoms wanes with age as a woman gets into menopause. So sometimes even when fibroids start becoming symptomatic at very late ages, we just tell the woman, no, you don't need to do anything, just wait. You are almost going into a place where you will have a relief. The fibroid natural on its own. But sometimes with fibroid, even after 50, is the size. Let's say a woman is looking like somebody 9 months. So even at 55, you have that kind of thing. It will just be advisable to take it out for you so that you can at least enjoy your life more.
Okay. So, your final words now.
Yeah, my final words, yes, as with my little practice, because, I will say that, look, for most young girls, our advice, if you want to have children, please, do it early. Don't wait. 30 to 30 is a good age to get married and have your children. Anything after 30, you don't begin ways, or if you hit 35, you don't finish with that. So as much as possible, if it's something, because there are people who are not going to be married, they don't want to be married.
They don't want to,
so if it's not your thing, no problem. But if it's something you want, because one of the things that have really gotten to me as a guy, when I see a woman 40, 41, 42, they are weeping, crying like a baby, that if I had known. Some have even had the surgery before their wombs. A lot of complications have come in. Do it while it's still early. Let's make hay while
the sun they shine.
Good.
All right, thank you very much once again, Dr. Emmanuel Anthony. Thank you very much for coming, sir.
Thank you.
And to you, listener, not already here, the education today massive. Even me, sir, At least if I don't learn anything, I learn menarche.
Yeah, becoming a gynecologist
yes,
already.
gradually we are becoming gynecologists. So I hope so now learn. So do wetin you supposed to do, and all those myths where you been believe before now, just as professional don't talk am now. You said you don't get the boldness to tell outsiders wey be like you before. So this is what we dey think say na like this, na like that e be. No be like that, e actually be. Oh, some people dey even blame their wives, say na your lifestyle, na your this, you don do abortion before, this one, that one. Doctors don clear us today, you understand? So thank you very much for listening. Don't forget to join us same time next week for next week will be our family game show. Yes, don't forget, if you bring your wife, if you bring your husband, come studio, let's play games, let's have fun, let's bond together. And the essence of the show be that. Once again, thank you very much, sir, for coming. All right.
Yeah, thank you.